Asthma, this one topic is big enough. I cannot just finish this in today's session. So definitely I will cover that in the next session. I will just go for the other two mainly and the other things which I need to mention. One is UACS, that is upper airway cough syndrome, a triad of cough, throat clearing, postnasal drip, and blocked and runny nose. I think we have got a lot of patients at this moment having this problem. See, persistent dry cough for at least 8 weeks duration, and there is patient will say, doctor, I can feel something that's in the back of the throat. Even they say, I can pull the string of mucus from the back of my throat. And it is perhaps one of the commonest cause of chronic cough in adults. In America, they consider it the most common cause, though in British, they are considered as the second cause rather. They are considering asthma as the most common cause. In our country, it's we can decide on whether it's the asthma or this one. Now, it is a combination of this problem. One thing I was wondering when I am presenting or preparing for this presentation, that there is one airway only, but so many disciplines are involved. We involve ENT, we involve pulmonologist, we involve gastroenterologist, we involve speech therapist, but and many other. It's in fact neurologists also nowadays get involved with this chronic cough management. But it is the one respiratory condition they all are dealing, and you are sitting in the middle. So patients sometimes can themselves go to this different disciplines. So they are not coming to you when you are able to deal with the whole thing. So you have to keep your mind open that when you can just deal with this problem and when you can't. So this particular problem is very common, this allergic condition, postnasal drip, and some infective sinusitis, be it bacterial, be it fungal. So problem with UACS, there is no pathognomonic finding, but there is sometimes people say that if there is cobblestone appearance on the back of the oropharynx, along with there some discharge on the back of the throat, you can just make 2 + 2 4 and diagnose UACS. Yes, you can do. But here the patient usually have this kind of cough more, and sometimes a bit of this kind of throat clearing cough. History, physical examination, imaging, and response to therapy. When we talk about imaging, obviously that is not always required. But when we talk about the history and diagnosis of this cough, this unpleasant sensation in the throat, some postnasal drip and cobblestone mucosa, as I've mentioned. Some other diagnostic features when patients complain of nasal things, that whether there is any nasal symptoms like symptom of rhinitis, patient is having sneezing, wheezing, hoarseness of voice, or there's some seasonal triggers or occupational triggers. All this history are important. If you diagnose a case of UACS, you can always give a trial of this therapy. I will coming to that therapy, what you can always give, and then see before you can ask for some tests like even CBCS or chest X-ray, whether it is necessary or not. So first thing, even some treatment trial can be a part of the investigation. So if you give a treatment, patient responds and patient feels well, yes, this is the diagnosis. But if you can't come to the diagnosis, you can do some more tests. It's not always easy to find out a single test for this diagnosis of UACS. Treatment, it's definitely all of you know what always we say, the use a humidifier or steam inhalation. One thing I would like to tell you here, that when people inhale steam, sometimes we ask them to use a lot of things in the water. They can just inhale the simple steam. nothing adding in the water is required. Second is that for inhalation of steam, they should not inhale the steam, because that moist air can go to the back of the nose or back of the throat and cause more problem and bring more cough, or they burn the mucosa, causing more trouble. And they don't want to do it after that. So ask them just to open their mouth and sit there for some time when the vapor is coming out. Sleep on a propped up pillow, nasal irrigation. So you can use that. Mucolytic agent nowadays, some people are using that. Now, I cannot give you any brand name here. Allergic causes you can use. So I have said that there may be allergic causes, or there may be non-allergic causes. In allergic causes, only topical corticosteroid antihistamines work. But in non-allergic causes, sometimes we have to use decongestant, and antibiotic as well, like bacterial sinusitis causing postnasal drip. There is mucky flame is also coming out. In that case, there is not much evidence on use of anticholinergic.